Wow, it's Mila Political, Season 2, Episode 3. Is it mild? In today's episode, we are going to talk about Omicron. A lot about Omicron. So, heads up, content warning. We're talking about Omicron. We're talking about lockdown uh, policies, COVID pandemic policies. That's sort of where I'm going to focus. I am going to reference from actual medical authorities on why Omicron is not mild, um, specifically the World Health Organization, the Mayo Clinic. Uh, yeah, so we're gonna we're gonna like reference some authorities. We're also going to talk a little bit about something called argument of authority, or call to authority, which is a logical fallacy. We cannot just simply say, oh, this authoritative figure said that this is true, right? We actually have to, the authoritative figure we're referencing actually has to have like a history of accuracy. And also, we have to be willing and open to look at the ways that, people in less privileged positions might criticize that, like, might have a different perspective on things. That is not to say that anti-maskers are less privileged. Um, that's a mixed bag, and we could talk about that all day, but I'm pretty sure I covered a little bit in a previous episode about how a lot of the anti-mask protests were led by a group or created by a group out of Germany, and in Canada they were largely led by the People's Party of Canada. Um, so it's very much a very select group of people with a political agenda. So not an underdog thing, not an underdog thing. But like there's good criticisms to be made about concerns about the medical industry and its abuse of women, people of color, racialized people, indigenous people, right? Um, so let's keep an open mind, not rely strictly on authority, but also heavily rely on the science when it is accurate. Like consensus. Science is a complicated thing. It's really fun. I really think more people should get involved in scientific studies, like in the idea of scientific study. But like I am an academic, so criticize me for that too. Saskatchewan Premier says strict COVID-19 restrictions cause significant harm for no significant benefit. This is on CBC. What a headline, CBC. It also does not reflect the full content of the article. It's very clickbait and is going to cause people to say false things. Anyways, Saskatchewan, it's where I grew up till I was 11, the only province to not implement gathering capacity limits in response to Omicron. What a shocker. What a shocker. A prairie province being very conservative. Wow. Not a good approach during a crisis. Saskatchewan is not expected to implement further measures to curb the spread of COVID-19. It is the only province to not implement gathering or capacity limits in response to Omicron. During COVID-19 update on Monday, Premier Scott doubled down. He said Mo said that Saskatchewan trails other provinces in hospital admissions. He said that Quebec has stricter measures but higher hospitalization numbers in Saskatchewan. Percentage numbers, Saskatchewan has far fewer people than Quebec, population wise, per capita. So, like, yeah, you're gonna see smaller numbers. We have to be very careful about how we use whole numbers, like total numbers, I should say, and how we use percentages, right? Comparing two places that have very drastically different populations in total number you're better off not generalizing between them to begin with, because density is different. But also, if you do compare, if there is anywhere you can compare, probably better to compare in percentage, as opposed to, if you have the same location facing multiple different waves of COVID, you're better off to look at total numbers instead of percentages. We'll get into why that is in a moment, when talking about if Omicron is mild. All right, the evidence is right here in Saskatchewan. This is what Mo said. All right, Mo said the evidence is right here in Saskatchewan as we manage through this Omicron wave with very little in the way of restrictions on people's lives, and we have lower rates of hospitalization rates. He does not saying numbers, he's saying rates, so that's percentages. Lower rates of ICU admissions, again percentages, and lower rates, thankfully, of fatalities through the month of January, again percentages, than many other provinces with much more severe restrictions. Quebec does have some severe restrictions. They have curfew, which I'm still not sure the science behind it, and I would love to see some evidence for it. But like, the question in my brain is always, what is Omicron doing during the day? Does it take a break? Does it like stop? All right. If you need people to stay at home, you're better off with a lockdown. In this case, it's not like, this isn't like, yeah, right? Like, what does a curfew do? What it does actually is it really harms very marginalized folks like homeless people, and other kinds of workers, which I feel if I clarify that more specifically, I'll get in trouble with YouTube. So we'll stick to just saying that. Let's talk about hospital bed capacity, Mo. I grew up also, like, I want to say too, like, it's the middle of winter in Saskatchewan. Like, I grew up there. Like, we're talking, these winters get down to like -30, -40 on a regular. Like, this is a normal thing. Like, we're talking frostbite is very possible. It's a dry, harsh cold, right? Like, people aren't going out. Not that much. Like, they'll go out to different events for sure, but like, people go out far less in the winter. At least they did back in the 90s. I'm just like dating myself there. Ugh, I am old. I'm not that old. I'm still a young spry person. Let's talk about hospital bed capacity. So the health minister, Paul Merriman, said at Monday's update that Regina and Saskatoon, these are like their major cities, their hospital beds are currently at capacity. That's so, rates for what they're worth, not much. But the province-wide 85% of hospital beds are occupied. This is showing that we are prepared for what could be more people coming into the hospital system. Yeah, so they have... Cool, you have to go to the hospital. We're going to send you to, like, Moose Jaw or Elbow. Like, what? Yeah, you get to go somewhere else, out of the city. Get out of here. Get out of here, you sick people. The Premier said patient transfers might be necessary as hospitals in urban centers continue to fill up with Omicron patients. So we would, I think, ask for a little bit of leniency and patience with families that may need care in those urban centers. Sorry, kids. You need your you need hospital care. You gotta wait, cause Mo said it's okay to party. That's such a prairie thing. Official opposition leader Ryan Mealy. This is the part that I think should have been like stuck right in the middle, like just inputted like in the first few paragraphs. Just be like, despite criticism from opposition leaders, see below, like people left this article like on the fifth paragraph at best. Like, people don't stick around for articles. They don't read that much. So he said during a media event on Monday that he opposes Mo's decision. He said, quote, he has the modeling in front of him. He knows how many people are going to be sick. He knows, so predictive modeling is very effective. They know how to model these things. He knows many people are going to die. He knows the healthcare workers will be put under incredible pressure. He knows that surgeries and other important essential parts of care will be canceled. This is really important, right? So as hospitals get put under stress like this, their resources become very limited. So essential surgeries, we're talking like removal of cancer cells, we're talking gender confirmation surgeries, we're talking transplants, we're talking like all kinds of things. Those are going to get pushed up, right? And so that has real consequences to people. Some people might not survive that, right? So just because there are fewer COVID deaths does not mean that there isn't an unjust loss of life. He knows that his choices are going to cause people to suffer, Mila said. The Saskatchewan NDP leader said Mo's statement that residents should learn to live with Omicron is the most irresponsible thing I've heard from a very irresponsible man. So those are Ryan's words. So he also said, quote, there may come a time when COVID-19 is endemic, where it's a regular part of our lives, where we're doing annual shots like we do with the flu shot. These are places we could get to, but to pretend that we're there in a way that causes people to fill up our hospitals and die is absolutely criminal. This is really important, right? We want Omicron to become weak and milder. We want it to actually become milder. We want to control its spread until it becomes harmless to us. It is not currently at that spot. And we'll get to that. So this is very big for a reason, because there's a video here. You can read this article if you want. I haven't actually read the article. I just wanted this for this video.
The dawn of a new year offers an opportunity to renew our collective response to a shared threat.
So this is Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. Again, this is what we would call an authority on, health. There's a lot of scientists who are part of this. It's a very political and politicized organization, but they do reference, like, it's a research and science-based organization. And ultimately, good science does actually go, it doesn't go beyond politics, but good science is evidence, right? And so good science can be referenced and inform us on how to go about our lives, like what is impacting them, especially during a crisis like this, where like COVID really is a non-political issue. It's a virus. It doesn't care if you're an anarchist, a conservative. It doesn't care if you're a fascist. It doesn't care if you're like a liberal, right? It doesn't care. It will infect you if you are not careful and the people around you are not careful. It will infect you and you will either get sick, very sick, or you will spread it to other people, right? Like it's not COVID itself is not a political thing. It does become politicized, but it is not itself political. And so we can study it and get just data from it, right? We can just see the data and then we can make our decisions and form policy from that. So let's see what the Director General says.
I hope global leaders who have shown such resolve in protecting their own populations will extend that resolve to make sure that the whole world is safe and protected. And this pandemic will not end until we do that. Last week, I asked everyone to make a New Year's resolution to get behind the campaign to vaccinate 70% of people in every country by the middle of 2022. And on top of that,
so what he's going to get into in a minute is what I call vaccine apartheid. We have a big issue around the world. You'll hear what he says too. We have a big issue around the world where vaccines cost too much. Thanks, capitalism.
To ensure that breakthroughs, treatments, as well as reliable tests are available in all countries. To end the acute stage of the pandemic, the highly effective tools science has given us need to be shared fairly and quickly with all countries of the world. Vaccine inequity and
a lot of people are going to be like, oh, what is this, socialism? You can't just give stuff for free. It's like there's an economic cost to not giving it for free. Actually, if we want to ignore the debate of whether or not we should have a stateless, moneyless society under anarchist, socialist, whatever, or if we need a capitalist utopia, if we want to ignore that, it doesn't actually matter which one you want. The pandemic is destroying the economy, and by not ensuring everyone is safe, you're actually just destroying it further. So
health inequity overall were the biggest failures of last year. While some countries have had enough personal protective equipment, tests, and vaccines to stockpile throughout this pandemic, many countries do not have enough to meet basic baseline needs or modest targets which no rich country would have been satisfied with. Vaccine inequity is a killer of people and jobs, and it undermines a global economic recovery. Alpha, Beta, Delta, Gamma, and Omicron reflect that in part because of low vaccination rates.
Yeah, sorry, just to cut him off there for a second. But yeah, you see what he said a moment ago? These things, this is affecting the global economy. And now I like to make a point that economics, it's my minor because I do like it. Even Karl Marx thought of the economy as the very basis of human society, right? Everything emerges from how we according to Marx and historical and dialectical materialism, everything emerges from how we manage resources. Resources are at the root of social behavior, right? Your basic needs are a critical thing, and then our wants and desires are also a factor in how we function as a society. And then how we build up society beyond that is how we decide to distribute those goods, services, etc. Right? So regardless of what kind of economy you want, there is always an economy. It's just how, according to this theory, I agree with it. So there's always some kind of an economy, And like how it functions doesn't really matter when you're faced with a pandemic. Like what structures we built on top of it don't matter. The pandemic doesn't care. It would do the exact same thing to a socialist world. It would do the same thing to a fascist world. It doesn't care. Like, whatever economy you have, a pandemic like this will destroy it if you don't address it.
We have created the perfect conditions for the emergence of virus variants.
This is another thing, all right? So, the more people have a virus, the more chances it has to mutate, right? Because viruses mutate as they reproduce. And when you're sick, that's literally just a virus reproducing in your body, right? When you get even the flu, anything, that virus is having a party in your body. It's going to town. It is making a bunch of babies, and those babies are not exactly the same as the parent, right? Like it's got, maybe it's even got a little bit of your DNA in it, depending on the virus. All right, some of them will take some of you, and they'll like put it into themselves, and then like now those are literally like you and the virus's babies. So, but you don't want those. Those are bad, and they can end up causing mutations that can. Those mutations can get worse, and those mutations can get better. So if we have a ton of people getting the virus, we have a lot less control over what mutations are happening, right? You can get many mutations that could be really bad. You could get many mutations that could be really good. You're gambling is what you're doing, right? You're gambling. In this case, that's what I think is happening. Is that like they're like, well, maybe it'll just get weaker. That's not a guarantee, right? Like evolution doesn't function on a logical process. Evolution just functions on randomness. It is random. And then the idea of survival of the fittest is that like if something evolves that just has a harder time living, oh, I gotta reset that, then it won't survive. But like what that could mean is like a variant that could that could really get really bad and hurt people really fast to the point where they can't really spread that far, and then it becomes, so these are like speculative. This isn't what is going to happen. These are things that could happen. It could also just become very weak, and that is a good survival mechanism for a virus. The flu continues to exist, right? Because it's actually, at this point, it's pretty docile. There are some flus that are worse than others, and the flu still does kill people. But yeah, for now, the flu is generally speaking it's not as bad as Omicron. Though I would say that in a lot of situations with elderly folk, we should actually be even concerned about the flu, right? We should not have to accept that any virus would just cause the loss of life of any human being, right?
And burden surveillance system. Last week, the highest number of COVID-19 cases were reported so far in the pandemic. And we know for certain that this is an underestimate of cases because reported numbers do not reflect the backlog of testing around the holidays, the number of positive self-tests not registered, and burden surveillance systems that miss cases around the world. While Omicron does appear to be less severe compared to Delta, miss cases around the world.
Sorry. That's my bad.
While Omicron does appear
Yeah, so like, yeah, I think he speaks for himself in that point.
to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild.
We're also going to look at the Mayo Clinic in a minute as to what, you know, asymptomatic and like, yeah, we're going to address some stuff in a minute that, like, I would say even cases that don't go to hospital, we have to be conscious of.
Just like previous variants, Omicron is hospitalizing people and it's killing people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world. Hospitals are becoming overcrowded and understaffed, which further results in preventable deaths from not only COVID-19, but other diseases and injuries where patients cannot receive timely care.
That's what we were talking about earlier.
First generation vaccines may not stop all infections and transmission, but they remain highly effective in reducing hospitalization and death from this virus. I call on citizens.
That's the big thing, right? Like, vaccines are great, but also, like, we need to, like, slow the virus down, right? Like, we need to, like, slow it down so it can, like, so we can control how it mutates, right? The fewer people actually get this virus, the less it will mutate, right? That is the big critical point here.
Of the world, including civil society, scientists, business leaders, economists, and teachers, to demand that governments and pharmaceutical companies to share health tools globally and bring an end to the death and destruction of this pandemic. We need vaccine equity, treatment equity.
Yeah. So sharing those tools. Oh my gosh, is this like a commie? We're getting into some socialist shit.
Test equity and health equity, and we need your voices to drive that change. Equity, equity, equity.
Equity. All right. And that's from the Economic Times. So you can find that URL down below. It really gets at a very important aspect of this, and that is the way that, like, us in, like, Canada, the US, Europe, Australia, like, the way we've been able to, like, exist with all this tech, right? Like this, access to the vaccines, access to rapid tests, which we now, like, barely have. Like, they're rationing out those now. Like, we've benefited from this, and now we're just letting it go. We're just letting Omicron happen, and that is, like, a lot of places that don't have the capacity to actually vaccinate everyone are gonna have to deal with whatever variants come out of our nations, out of our communities, right? We're being extremely selfish in not ensuring that we don't get Omicron. All right, the Mayo Clinic. I want to talk a little bit about long-term effects. All right, sometimes it's called long COVID. COVID-19 symptoms, according to the Mayo Clinic, can sometimes persist for months. The virus can damage the lungs, heart, and brain, which increases the risk of long-term health problems. Most people who have coronavirus disease recover completely within a few weeks, but some people, even those who had mild versions of the disease, continue to experience symptoms after the initial recovery. These people sometimes describe themselves as long haulers. And the conditions have been called post-COVID-19 syndrome or long COVID-19. These health issues are sometimes called post-COVID-19 conditions. They're generally considered to be effects of COVID-19 that persist for more than 4 weeks after you've been diagnosed with the COVID-19 virus. Other people and people with many serious medical conditions are the most likely older people and people with serious medical conditions are the most likely to experience lingering COVID-19 symptoms. So what this is saying is people who are already disabled are far more likely to experience persisting COVID-19 symptoms. I wonder though if maybe that's just that people who were not already disabled, the impacts are not severe enough for them to notice, but if the impacts are still there. I think that's an interesting point of study that should happen. The common signs and symptoms that linger over time include fatigue, shortness of breath or difficulty breathing, coughing, joint pain, chest pain, memory, concentration, or sleep problems, muscle pain or headache, fast or pounding heartbeat, loss of smell or taste, depression or anxiety, fever, dizziness when you stand, worsened symptoms after physical or mental activities. So as someone who, I have depression diagnosed, so I do actually struggle to get up in the morning quite often. That concerns me. That concerns me a lot. I also have executive dysfunction because I'm non-neurotypical. I have ADHD. So concentration and memory problems, I would not want to have that exacerbated. I already have to have accommodations in my classes. I don't need this to get worse. Organ damage caused by COVID-19 is also a thing. Although COVID-19 is seen as a disease that primarily affects the lungs, it can also damage many other organs, including the heart, kidneys, and the brain. Organ damage may lead to health complications that linger after COVID-19 illness. In some people, lasting health effects may include long-term breathing problems, heart complications, chronic kidney impairment, stroke, and Guillain-Barré syndrome, a condition that causes temporary paralysis. So I take hormone replacement therapy, which can impact the heart. I do not want to have heart complications because that could make my gender transition, my particular one, because not all transitions require medical transition, but mine, it can make it more dangerous. Blood clots and blood vessel problems. COVID-19 can make blood cells more likely to clump up and form clots. While large clots can cause heart attacks and strokes, much of the heart damage caused by COVID-19 is believed to stem from very small clots that block tiny blood vessels, capillaries, in the heart muscle. Other parts of the body affected by blood clots include the lungs, legs, liver, and kidney. COVID-19 can also weaken blood vessels and cause them to leak, which contributes to potentially long-lasting problems with the liver and kidney. Other parts of the body affected by blood clots include the lung, legs, liver, and kidney. I just read that. Problems with mood and fatigue. People who have... Anyways, I could go on. You can read the whole thing. Many long-term COVID-19 effects still are unknown, much is still unknown about how COVID-19 will affect people over time, but research is ongoing. Researchers recommend that doctors closely monitor people who have had COVID-19 to see how their organs are functioning after recovery. Many large medical centers are opening specialized clinics to provide care for people who have persistent symptoms or related illnesses after they recover from COVID-19. Support groups are available as well. It's important to remember that most people who have COVID 19 recover quickly, but the potentially long lasting problems from COVID 19 make it even more important to reduce the spread of COVID 19 by following precautions. Precautions include wearing masks, social distancing, avoiding crowds, getting a vaccine when available, and keeping hands clean. Yeah, so I think that pretty clearly puts it out there that we need to take care to study and understand long COVID or persistent COVID symptoms. And not only that, but it, I am curious to know what are the impacts of repeated exposure, repeated infection, right? How bad can these get? Do they get worse? But like, can they get worse? And if they can, how bad worse can they get if someone gets COVID a second time or a third time? And that is possible. That is 100% possible. People have gotten it multiple times. So I would really like to know that. And I would like to know why so many governments are just letting this happen now, when not only could just letting it go fill up hospitals, as the NDP from Saskatchewan was concerned with, overburdening the medical system. But like, what is the impact on the medical system going forward with all these other symptoms? I want to now talk a little bit about my school. And they sent us out an email because they're sending us back to in-person classes. And I don't really have a choice. I can fail my class. My professor did not want anyone to message him or talk to him about this. So he hasn't really given us an option for my one in-person class. He hasn't given us an option to discuss this with him. He told us to go straight to the head of the department. I did. I got moved up even further to the dean and the vice president. So this is what the school is saying. There's going to be a return to on-campus learning with exceptions. They're saying we are looking forward to returning to on-campus classes on Monday. I'm not, and I know there's a bunch of students who aren't, because no. The decision is in line with recent recommendations of Dr. Strang. He's our local government, COVID guy. He's a doctor. He's a medical doctor. To the Council of Nova Scotia University Presidents. He didn't talk to me about it. I'm not okay with it. That universities resume in-person classes in support of student well-being. What? Student well-being? I'm stressed. This is impacting my ability to do my homework on time. I do not want to go back into classes. I'm afraid of getting sick. I have vulnerable people in my bubble. I don't want them to get sick. They cannot guarantee that people are going to mask in that building. First of all, my building has bad ventilation. Second of all, there are all kinds of nooks and crannies where people can just take off their mask if they really want to. Sorry, I bumped that. I'm not editing this. Anyways, no, I don't. I am stressed. I am so stressed. MSVU has led the way in ensuring safe campus environment throughout the pandemic. They say, and the return to on-campus instruction is enabled by our significant multi-layered COVID-19 safety approach. Oh, such a complex multi-layered approach that is being further strengthened currently. Please read on for those details. All right, let's give my school the benefit of the doubt, all right? Shall we? This is going to be our Is It Mild game show. I don't know. Let's give them the benefit of the doubt. Maybe they have a really good plan, all right? Now remember, really good things are masking. Stay masked constantly. Social distancing helps as well. Getting vaccinated, though it doesn't prevent you from getting sick, and it doesn't prevent you from getting long COVID symptoms. Getting vaccinated, all right? I forget. There was a fourth one. I forget what it was. But, let's see this. Following consultation with faculty, not students though, and consideration of multiple factors, not me though, some classes will remain online or adopt a blended approach. Not mine. Learn about models of delivery here. I might have to pressure my professor to not send me into class. Once approved, instructors are asked to inform students of any change in the originally planned mode of delivery for each of their courses by Thursday, January 27th. Students should reach out to their instructors if they have not heard by that date. Students should changes of modes of delivery for any of our courses result in an on-campus class next to an online class in your schedule. You don't have to rush home in between. There's a list of quiet locations in which you can take online courses on campus. I don't want to stay on campus. If I have to go in for one class, I don't want to stay on campus. And I will get to the point of why. But spoilers, it's because you can't be sure that people are actually masking properly. And we expect to add more soon. Those who no longer wish to continue in a course due to a change in the mode of delivery are reminded of the university's course drop deadlines. I can't really drop a course unless I can get another one because I'm at my minimum courses. If I drop a course, I'm losing my student loans. Students who withdraw from a winter course before February 7th for any reason will not have a course notation on their academic transcript. Students who withdraw from a course between February 7th and March 14th will receive grade of W on their transcript, which stands for withdrawal without academic penalty. In other words, it carries no GPA implications. Anyone who is affected by COVID-19 related illness or isolation requirements is encouraged to speak to their instructor or supervisor regarding accommodations. A reminder that MSVU earlier shared a guidance on what to do if you test positive for COVID-19. A big problem is my province is not requiring people, it's not tracking this. People don't have to say when they're exposed. And there are schools that are just not telling people if there's exposures. Right, there's a group of parents who are tracking secondary school and primary school exposures because public schools aren't tracking them. And universities are also mixed bag. Some of them aren't doing it. Updated vaccine requirements. According to Nova Scotia Public Health, a multi-layered safety approach is key to slowing the spread of COVID-19. Those who will be returning to on-campus learning on January 31st should be assured that the university has extensive health and safety measures in place. But people have to follow them, right? We can't just call to authority, oh, they said that people have to do this, so people are doing this. No, people aren't doing it. This is the problem. Including our vaccine requirement, mask mandate, and enhanced cleaning protocols. There are a lot of places in the world where it's easy, specifically in the US, easy to forge a vaccine verification. Right? No. In response to the increased transmissibility of the Omicron variant and decreased test availability, our vaccine requirement is being revised to remove exemptions for non-medical reasons. That's good because people who have already, this is frustrating. The fact is that I never heard before reading this the other day. This is frustrating that there was exemptions for non-medical reasons. Why is there exemptions for non-medical reasons? Right? Okay, if there's exemptions on a national level for non-medical reasons, fine. But why are there exemptions? Make online courses. Make online courses. Make online courses. Make online courses. Actually, just make them online so that people who, for whether it's for religious reasons or political reasons, whatever, don't want to get their vaccine, they don't have to come in. Make everything a split. Put in little machines on the ceiling. They do this in some of the rooms. They do little cameras that record. So you can just have your lectures also be online. It's 2022. Why is everything in person? Just imagine like what could be done education-wise, the accessibility of education. And I think also this might be part of it, but I could be wrong. I think it's because it makes it very accessible. And like academia has a long history of being exclusive. And like that exclusivity gives it value. So like making it too accessible makes it less valuable, because if too many people have a degree, then the degree becomes less scarce. That devalues a field, like capitalistically. But like, sorry, move on. Let's do this. In response to oh shoot, where is this? Where am I? MSVU was notably the first university in the province to implement vaccine requirements last August, and as such has had this important protection in place for some time. At this point, more than 98% of students, faculty, and staff have 2 doses of an approved COVID-19 vaccine. And you know what? December last year, literally the end of classes, we had an exposure right in the cafeteria. So hopefully, I already have read this whole thing, so I'm kind of like being a little facetious here, but like hopefully masks are mandatory permanently in all spaces, and we are not allowing people to take their masks off, even to eat. That would be enough for me to be like, okay, maybe I'll go back in. In response to the increased transmissibility of Omicron variant and decreased test availability, very bad combination, our vaccine requirement is being revised to remove exceptions for non-medical reasons. This change will better align our vaccine policy with evolving public health directives and with similar provincial and federal policies. But do vaccines prevent long COVID? We need studies on that. Do vaccines prevent the spread? No, they prevent hospitalization. I don't want COVID. This change will better align our vaccine policy with evolving public health directives with similar provincial and federal policies. The university will be following up directly with small numbers of people who are affected by the change, those with exemptions that are not medical in nature. The deadline for these individuals to be fully vaccinated against COVID-19 is to be 2 weeks past their second dose, will be May 1st, in order to allow the 8-week required delay between doses. So like a lot of this is reasonable. I'm not criticizing these little details, right? I want to be clear about that. Yeah, get people vaccinated. That's great. Additionally, COVID-19 boosters are now available to everyone 18 and older in Nova Scotia. That's wonderful. Meaning most of our campus population is eligible for a 3rd dose vaccine. But like this does not address the other questions, right? We can't just pad bad policy with good information and good policy, right? Like we have to look at them individually. Like bad policy must be criticized. Good policy must be like thanked. I don't know, not thanked, but just like, you know, good job. Basic level of reasoning here. Mask mandate continues. Wonderful. 3-layer masks now required. Oh, that's really cool. That's wonderful. Maybe things aren't as bad as I thought. Let's read. Throughout the winter semester, masks must continue to be worn in all common indoor areas on campus, including the classroom, and whenever a distance of 6 feet cannot be maintained. I don't know what that means. Does that mean that, is that talking about outdoors? They should say even outdoors when you can't maintain 6 feet of distance. Per public health guidelines, 3-layer non-medical masks are required, effective immediately. Masks can be very briefly, I have N95s, so they protect me a little bit. Can be very briefly lowered to take a sip of water. Eating is not permitted in the library except in individual study rooms. Nope. No. 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 Already no. Done. No. And classrooms, as long as masks are required, unless a medical necessity, in which case please advise your instructor. No. If you're requiring vaccines for people for non-medical reasons, no, okay, make online courses for vulnerable people who will get worse conditions from long COVID. You are going to get people sick, and you are going to spread the virus and make people sicker than they already are long term. That's the problem. In common spaces, seating areas and lobbies, they're required. Masks should not be lowered unless you are actively eating or drinking. So in the cafeteria, nobody's going to be wearing a mask because that's what people were doing last time. And that's where the exposure was at the cafeteria. I wonder how many people got COVID from that. I don't know. Probably some of my friends who I haven't seen in a while. But sorry, I'm not editing this. You get that weird, gross voice thing. The cafeteria is a huge problem. Huge problem. People go there specifically to take off their masks. To go grab some food. It's a great moneymaker. It's an amazing moneymaker for the school. Or they bring some food and they sit down and they eat without their mask on. It's a socially acceptable way to express your frustration with masks. And you know what? It is going to get people sick. It is going to get me sick because that's where the exposure was. And my classes are right above there. I sometimes have had to walk through there. But now I'm going to have to go out and go around outside. No. This is my problem. We need to totally change eating right now. Sorry, but restaurants are not the answer anymore. Maybe if we could do some outdoors restaurants, but it's cold right now. Nobody wants that, right? Delivery is a good option. That's the best option, is delivery. But tell people to bring their own food, eat before they go to class, bring their own food, go sit outside. No eating indoors, especially considering there's 2 cafeterias. They're both in older buildings. One of them is not as bad, but the one that is in the building I'm in, that building has horrible ventilation. Absolutely horrible ventilation. All right? No. If that is taking place, you will need to ensure at least 6 feet of distance between you and others. The MSU website features a list of places where you can sit at a safe distance from others to eat. But still, the 6 foot distance helps, but it does not prevent 100%, right? It's not 100%. It's oh my gosh, I have no appropriate comparison. You know what I'm talking about, right? But it's if you were using a certain type of anti-pregnancy liquid, but not a rubber thing. You know what I mean? Right? Like, no. No. Campus remains open. As previously announced, campus is open and in-person services are available. As well, many student services are currently being offered both in person and through remote means, either online or by phone. Please check individual service web pages for more information. Additionally, residences remain open with enhanced protocols in place to help keep all students safe. For example, visitor restrictions and mask requirements. We have designated spaces and protocols in place to support any student who may need to isolate. Residence life will continue to update resident students, blah, 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 blah. Staff working arrangements, events and meetings, blah, blah, blah. Nova Scotia Public Health has changed its approach with regards to exposure notices and contact tracing. Due to that shift, MSVU will no longer be in a position to issue exposure notices for classrooms and other shared spaces, unless that information request is provided directly by public health. That's it. I'm not reading any more of this. That's it. That's it. That's it. That's it. We will not know that they're doing a good job because they will not say they're doing a good job. They're not going to say they're doing a bad job. This is completely out of place. This is completely inappropriate. But am I surprised? Not at all. Oh, here's my reasoning why I think masks should be permanent. All right, this is an open article. It's from Science Advances. Open articles are not necessarily always as accurate, but like this seems pretty reliable, and it's something that I can reference. And there are a lot of studies talking about this. Now, I'm not going to get into the jargon and the mumbo jumbo, all right, of this. You can read through it, all right? You can check it all out. You can figure it out, read through it. But I am going to talk a little bit about their findings near the end, all right? Because specifically, this is a good, we'll get to this in a minute. So this study was done in Korea. All right, here we are. This study was done in Korea, and it was done on their transit system. I'm assuming they got good ventilation in their transit system. This is an important aspect. It was done assuming an aerosol, that COVID spreads through aerosol, which is a big debate, but read as much as you can about it. I am of the opinion that it is an aerosol. The droplet theory seems to be a bit out of date. It's an older model, and the evidence is pointing towards COVID as an aerosol. And so that's what they worked with in this. They also, their model shows that masking and social distancing is absolutely fantastic. But like, you can see here, we'll get into it. One of the critical things here, though, they talk about all the ways that masks are very effective. When both social distancing and mandatory let me go back just one more. When only wearing a mask is mandatory without social distancing, such as in case 3, we'll look at that, a 95.8% reduction is observed because of the mask wearing, even if congestions occur. So like people like getting close to each other. Third, when both social distancing and mandatory mask wearing are implemented, such as in case 4, the compounded benefits of distancing and mask wearing result in a 96.6% reduction. In addition, the number of exposed individuals further decreased when social distancing is maintained in public transportation. However, the effect is not substantial, right? So case 1, case 2, case 3, case 4. Now, if you read through the study, what they did is they took data. They took 2 different data sets, and one of them was in Korea, when you go to the train, you have an ID card, you tap the ID card, you go on to the train, and then when you get off, it recognizes you again. So it knows when you get into the train station to go to a destination, it knows when you get off and you leave. And it is a critical form of they say in this article that it is a very important form of transportation. So they're getting a large, what you call a sample of their population. They're getting a significant sample of their population in this model. Not only that, they're getting small spaces, right? They're studying small spaces that, a lot of people are going into. And so they were able to see what was happening before lockdown conditions, because they're able to take that data and reference it to I'm assuming the medical records. So whatever cases emerged, they were able to see who was on the train, right? People who would have had COVID who were on the trains, and their connections, like who was interacting with who, and so they would have been able to connect the dots. So they would have been able to take that data from before mandates on masking and social distancing. They would have been able to take that data from different situations where social distancing was required, social distancing wasn't required, masking was required, masking wasn't required. And what they found was that when neither of those are implemented, you get ridiculous rates of COVID transmission. When there's just social distancing, it does reduce, but it's not that much. You still get quite a large, you can see these blue bars right here. You get quite a bit, right? Now these are you have to compare these, these aren't numbers, right? These are ranges, right? But you have to compare these to the case 1, these big orange ones here, right? Because that's without masks and without a mask mandate and no social distancing mandate. So we're going to compare all of these to case 1, right? So you can see, because on the left-hand side, you see the number of exposed, and then on the bottom is congestion level. So basically it's showing the highest amount of congestion on one end to the lowest on the other. And on all of them, it starts from 170 and it goes to 0. So it's a good measure. And the number of exposed starts at 12,500, goes down to 0. So these are comparable charts. It's always good to check these things. All right. With mandatory wearing of masks and no social distancing, you can see that these rates are, like they said above, like 92, 93%. Anyways, it's very, very good. And when you have mandatory mask wearing and social distancing, again, you don't see any numbers above 150 because social distancing prevented that, right? But it's gone. These are such small rates of transmission. And, to an extent, there is actually only so much that we can do to prevent the spread of COVID without just completely taking away human rights, right? And I do respect that, but I find that argument is often being used to distract from a more serious issue. And that issue is, one, we're not tracing this information anymore where I'm at, right? Korea was able to do this because they have the data, right? That is a respectable use of data, is being able to show how this crisis is being mitigated, right? And mind you, Korea is still facing severe outbreaks of Omicron. This is Korea's all-time cases and deaths. So these are new cases, right? And these are their deaths. So they are experiencing quite severe peaks, which goes to show that Omicron is not mild, right? But that being said, they clearly do have an awareness and a capacity to really actually take care of their people. Omicron just spreads ridiculously fast. But lockdown measures, in this case, mandatory mask wearing, mandatory social distancing. Obviously, social distancing is not as effective, but as you can see, it does have a pretty important limitation there, where these are the highest instances of transmission with mask wearing. They're gone on this side, and like you can see different spots too where it's a bit higher. But mandatory mask wearing destroys transmissibility. But the moment you have a campus cafeteria where everyone can go and sit down and not wear masks, completely defeats that, especially in a building with bad ventilation. That's what I'm getting at. And the same goes for Saskatchewan. Like, you know, by not ensuring permanent mask wearing within these kinds of public facilities and institutions, you are allowing people to get sick, potentially go into the hospital. Even people with the vaccines can become hospitalized, right? And because of how virulent, how easy Omicron spreads, even though the percentages will be smaller, the numbers may be as much or even more than what we had before. So it's just, there's a complete disregard for the actual science, which I'm very disappointed is coming from academic institutions. But also, you know, we cannot always assume that an academic institution is a house of science in a world that is run on money. Yeah. So I'm gonna call it that. Thanks so much for stopping by, coming by to watch. I would like to thank my patrons, Justine and the Blue Druid. Thank you so much. If you are interested in supporting me, you can check out a number. Oh, hold on a second. You can check out a number. Oh, no. All right. Open broadcast software is giving me a hard time here. You can check out a number of my links here, allmylinks.com, Mila Political, patreon.com, which you can find there as well, Mila Political, coffee.com, Mila Political. These are all places where you can find my other social media on all my links, and you can also support me on Patreon and Coffee, either with regular subscriptions on either of those, which will give you a recognition on at the end of all my videos, or you can tip me some money over at Coffee. I do have a campaign on there to help get me some electrolysis to get rid of my facial hair, because it is very dysphoric. And yeah, stay tuned for more weekly content on covering various news topics, deep dives. I might do more deep dives like this. Let me know if you like this kind of deep dive content, where we really get into one subject, or if you'd rather I go and do what I did the last two episodes, where I sort of cover either one general topic and just look at different news stories, or I cover multiple news stories, like I did in my first episode of this season. I am experimenting a little bit. I'm trying out a few things. This is definitely going to be the aesthetic. It's very like low effort. If you want more video essay type stuff, I am working on a video essay for Mila Theoretical. You can check that out as well. And yeah, thank you so much for stopping by, and you have a good day.